Have you ever found yourself sitting in a cold doctor's office, looking over a list of recommended tests and wondering, do I really need all of these? Do they actually help? Or are they just another step in a long medical process that keeps you in and out of hospitals, labs, and clinics? For seniors, especially those over 70, this question isn't just important, it's critical. Because while some health checkups are genuinely life-saving, others can do more harm than good. And the harm isn't always physical. Sometimes it's emotional, psychological, financial, and sometimes it slowly chips away at the very thing retirement was supposed to bring: peace of mind. This isn't a video against doctors or against medicine. It's a video for you, for your wisdom, your experience, and your right to make informed decisions about your own body. Today, we're going to explore 5 health checkups that many seniors are still told to get, even though they often bring more risk than reward. And we'll do it with care, honesty, and real-life stories that show why this matters so much. Our first stop is a test that nearly every man over 50 has heard of: the PSA test for prostate cancer. On paper, it's simple. Just a blood test to check for elevated levels of a protein linked to prostate cancer. But what it often leads to? That's where the story gets complicated. Harold was 74, a retired postman from Ohio. He was healthy, walked every morning, cooked his own meals, even volunteered at the local library. During a regular checkup, his doctor suggested a PSA test. Just a precaution, the doctor said. So Harold agreed. A week later, his results came back slightly elevated. That triggered more tests, then a biopsy. It was uncomfortable, invasive, and filled him with fear. The diagnosis: early stage, slow-growing prostate cancer. The doctors told him it was unlikely to spread, that he might live another 15 to 20 years without ever being affected by it. But once the word cancer was said aloud, Harold couldn't let it go. He opted for surgery. Then came the side effects: incontinence, impotence, anxiety. Months later, he told his son, "I think I gave up years of peace for a fight I never needed to start." That's the truth of the PSA test. In many men over 70, it detects cancers that are so slow-growing they wouldn't have caused harm in their lifetime. But the emotional impact of a cancer diagnosis, no matter how small, leads many to choose treatments with painful, irreversible consequences. The American Urological Association now suggests that men over 70 who are not at high risk may not benefit from PSA screening. The question every man should ask is, will this test change how I'm treated? And if the answer is no, maybe it's better not to look for trouble that doesn't need solving. Now, let's talk about another familiar test, one that nearly everyone dreads, but many still undergo out of habit or fear: the colonoscopy. Colonoscopy screenings have saved lives. They've caught dangerous polyps and early cancers. But after the age of 75, the equation changes. The risks of the procedure itself, perforation of the colon, complications from anesthesia, internal bleeding, begin to outweigh the benefits, especially if you've had previous clean screenings. Let me tell you about Margaret. She was 78, a retired schoolteacher. She had 3 colonoscopies in her life, all clear, no family history, no digestive symptoms. But during a routine visit, her doctor, who had only been seeing her for a year, recommended another one. Margaret, polite and trusting, agreed. During the procedure, there was a complication: a small tear in the colon, emergency care, a week in the hospital, months of discomfort, all to confirm that she was, as she had always been, perfectly healthy. Colonoscopy isn't evil. It's a powerful tool. But after a certain age, especially when you're symptom-free, The tool can become a weapon, used too casually, without weighing the risks. The U.S. Preventive Services Task Force recommends stopping routine colon cancer screening around age 75 for people with average risk. And if you've had multiple clean tests before, the chance of finding something dangerous at 78 or 80 is incredibly low. So ask your doctor, do I really need this? What are the chances this test will change anything? And if those chances are small, maybe you've already done enough. Now, let's shift focus to something very personal and emotional: breast cancer screening. For many women, getting regular mammograms has become routine, a habit of self-care, and it's true. Mammograms have saved lives. But as we age, especially beyond 75, the math of risk versus reward begins to change. This is Emma's story. Emma was 80, widowed, independent, still living in the house she and her husband had built together. She was active, sharp, and proud of taking care of her own health. Her daughter convinced her to go for one more mammogram, just in case. It found something. A shadow. More scans followed. A biopsy. Weeks of waiting. Then the diagnosis. A non-aggressive tumor, unlikely to grow or spread. The doctors said she could leave it alone, but the anxiety had already taken root. Emma opted for a lumpectomy. Then radiation. Her recovery was long. Her energy, once vibrant, never quite returned. Later she said, "Maybe I should have just kept living my life." The truth is, many tumors found in older women are so slow-moving they wouldn't affect their lifespan. But the stress, the procedures, the emotional toll, they're real. The American Cancer Society says the decision to continue mammograms after 75 should depend on life expectancy and personal health, not just age. If you're over 75 and considering another mammogram, ask yourself, will this change the way I want to live? Will knowing help, or will it make me afraid? Next, let's look at a test that's often done with the best of intentions, but can sometimes open a door to more trouble than it's worth: the bone density scan, or DEXA scan. The goal of the DEXA scan is to identify osteoporosis before it causes fractures. But for seniors over 70, especially women, the results often lead to medications that carry their own set of risks. Like Martha. She was 76 when her doctor recommended a DEXA scan. She had no history of fractures. She was steady on her feet. The scan showed mild bone thinning, osteopenia, not full osteoporosis. Still, her doctor prescribed bisphosphonates to be safe. 3 months later, she had jaw pain, then severe heartburn, then came the dental issues, all from a drug she might never have needed. Her bone loss was minimal, she had no symptoms, but once the label was attached, the medication followed. Here's what many seniors don't know. The biggest protection against fractures isn't always a pill. It's staying active, eating calcium-rich foods, fall-proofing your home, working on balance and strength. DEXA scans can be useful, but only when there's a reason. If you've never fractured a bone, if you're mobile and strong, you may not need that scan at all. Talk to your doctor about your real risk, not just the numbers on a chart. Finally, we arrive at the last checkup that many seniors are pushed toward, often without symptoms or any signs of concern: the heart stress test. The name alone sounds serious. It's meant to find hidden heart disease, but when you don't have symptoms, no chest pain, no shortness of breath, this test can lead you down a very difficult road. Take Robert, age 79, no history of heart problems. Active, walked 2 miles every day. His doctor offered a stress test just to check. The results were unclear. Maybe something, maybe nothing. So they ordered more tests. Then a cardiac catheterization. During that procedure, there was a complication, a reaction to the contrast dye. He spent 3 days in the hospital. In the end, no heart disease, just stress, time lost, and a feeling that he'd been made into a patient for no reason. The truth is, stress tests are most helpful when someone already has symptoms. If you feel fine, they're less likely to help, and more likely to find maybe problems that lead to risky procedures. As you age, the goal should shift from chasing every possible condition to protecting your quality of life, your comfort, your freedom, your time. So, what's the bottom line of all this? It's not about saying no to health care, it's about saying yes to personalized care, to asking questions, to knowing your body and your values. The older we get, the more we realize time is precious, energy is sacred. Not everything needs to be fixed, not every test needs to be taken, and not every diagnosis needs to change the way you live. If you've made it this far in the video, thank you. It means you care about your health, but also your peace of mind. So before your next doctor's visit, remember this. Ask if the test will actually change how you're treated. If it won't, maybe your greatest act of self-care is to simply keep living well. If this video helped you or opened your eyes to something new, please give it a like. It helps more seniors find this information. And don't forget to subscribe for more honest, respectful, and empowering content made especially for you.